We shall also be challenged by the changes in our demographic profile, where Malaysia is becoming an aging state by 2030.
Aging. World Health Organization defines an aging population as when the elderly population of 65 years and above of a country reaches 7.0% of its total population. Malaysia has adopted the United Nations definition of those aged 60 years and above as older persons for aging, credited from Age Expo, Asian Senior Care, and Wellness Expo Malaysia. Malaysia's old age population is steadily increasing. Malaysia will become an aging society by 2030. As mentioned, Malaysia's old age population is steadily increasing. Aging is associating with elderly's health and well-being, which directed to the subject about the lifestyle of Malaysian elderly in managing health and well-being. Health and well-being are measured by the demography of morbidity among the Malaysian elderly. Institute of Public Health under the Ministry of Health Malaysia provide a demography of various populations in Malaysia, specifically named as National Health and Morbidity Survey, provides health-related community-based data and information to the Ministry of Health to review health priorities, program strategies and activities, and to plan for the allocation of resources for elderly health care services. This survey was conducted as a nationwide community-based survey targeting elderly aged 60 years or more. Data were collected via face-to-face interview at respondents' homes using mobile devices with various assessments done based on topics. A total of 5,636 living quarters were approached, with 7,117 respondents successfully interviewed, of whom 3,977 were elderly aged 60 years or more.
Highlights from the elderly aged 60 years or more in Malaysia. Non-communicable diseases, NCDs, in particular diabetes mellitus, hypertension and hypercholesterolemia have shown an increasing trend globally, and the prevalence of NCDs in Malaysia continues to rise. 27.7% of the elderly reported themselves as having been told to have diabetes by a medical professional. 80.5% of elderly reportedly had diabetes screening in the past 12 months. 51.1% of the elderly reported themselves as having been told to have hypertension by a medical professional. 79.0% of elderly reportedly had hypertension screening in the past 12 months. 1.6% of elderly similarly reported having been told to have cancer. NCD risk factors. 41.8% of the elderly reported themselves as having been told to have hyperlipidemia by a medical professional. 75.5% of elderly reportedly had hypercholesterolemia screening in the past 12 months. 13.3% of the elderly admitted to being smokers. Disability. Vision disability was reported by 4.5% of the elderly. The main causes of blindness among the elderly, most of which are avoidable and preventable, are cataract, glaucoma, age-related macular degeneration, and diabetic retinopathy. Hearing disability was reported by 6.4% of the elderly. Researchers in the United States found that age is the strongest predictor of hearing loss, with the greatest likelihood of hearing loss in the oldest group surveyed, aged 60 to 69.
Nutritional status. Poor nutritional status in the elderly population is a public health concern. 30.8% of the elderly suffer from malnutrition. 5.2% of the elderly are underweight. 37.0% of the elderly are overweight. 17.6% of the elderly are obese. 36.4% of the elderly have abdominal obesity. 10.5% of the elderly have muscle wasting. These are a few of the most common diseases among elderlies. More information on diseases among Malaysian elderly can be referred at the Institute of Public Health website.
Any tips for the rest of us on how to get to the age of 94 and be, what do? Do you eat yogurt or how do you do this?
In the first place, I don't know. I've been spared, but I do practice certain things which I think contribute to being a little bit more healthy than others. One thing I advise people is not to eat too much.
Yeah.
Eat to live and not live to eat. And see, when you see people at the age of 40 bulging around there, that's the time to stop eating too much. I follow my mother's advice. When the food tastes nice, stop eating. That's very...
Okay, yeah.
The reason is very simple. When I was studying medicine, I realized it was very sensible, because when the food tastes nice, you tend to eat more. So be active, and I think you may survive to 94.
Okay.
However, illness and ailment can be hindered by practicing a healthy lifestyle. Does Malaysian elderlies are living healthily? Physical activity and sedentary behavior. Physical activity is defined as any bodily movement produced by skeletal muscles that require energy expenditure. Regular physical activity is proven to help prevent and treat non-communicable diseases, NCDs, such as heart disease, stroke, diabetes and breast and colon cancer. It also helps to prevent hypertension, overweight and obesity, and can improve mental health, quality of life and well-being. Dietary practices. Fruits and vegetables are a source of vitamins and minerals when consumed as it is, or in fluid form. The benefits include reduced likelihood of chronic diseases, improved physical function and walking speed, reduced walking disability and frailty among elders.